Dr. Chelsea Singleton is generously sharing her insight on today's theme, food access and nutrition. Thank you to United Way of Champaign County, PNC Bank, Champaign-Urbana Public Health District, CU Mass Transit District, and our other sponsors for sponsoring this event.
Hello, my name is Chelsea Singleton, and I'm an assistant professor in the Department of Kinesiology and Community Health at the University of Illinois at Urbana-Champaign. And I'm happy to be speaking to you today as part of the YWCA's wonderful Stand Against Racism campaign. The title of my talk is Moving Towards Nutritional Equity, Understanding the Historical and Current Impact of Racism on Community Nutrition. So, by the end of my talk, I would like you to understand a few things, okay? By the end of this talk, I hope you will understand how structural racism has historically impacted healthy food access and community nutrition in communities of color. The second thing is, I hope you understand how structural racism currently affects healthy food access and community nutrition in communities of color. I want you to learn how communities of colors are taking action to address structural racism in their community. And then also, I would like you to know what you can do to take a stance against structural racism so that we can improve community nutrition and address nutritional inequities in the state of Illinois, in our local communities, as well as across the entire country, okay? So what's the issue? Let's start with that first. For decades, researchers have reported disparities in the availability of affordable, healthy foods in the United States. I always like to emphasize affordable because, of course, we want to make sure that all communities, regardless of racial, ethnic composition, regardless of socioeconomic status, we want to make sure that these communities have access to healthy food and that they're affordable, okay? So the food needs to be affordable, it needs to be culturally sensitive and appealing in order for us to, really make change. However, several studies have shown that communities of color, specifically mostly Black communities, mostly Latino communities, they are significantly more likely to be labeled a food desert. So if you're a food desert, you have limited availability of retailers that sell affordable, nutritious foods, okay? Living in a food desert has been linked to a number of adverse outcomes, including food insecurity. So food insecurity is when you have limited resources, or you have limited you have limited financial resources, which impacts your ability to actually acquire healthy food, which then can position you to experience hunger. Living in the food desert is associated with poor nutrition and poor diet, and even obesity. And that's a major issue because being obese is associated with a number of adverse outcomes, including type 2 diabetes, hypertension, cardiovascular disease, and even cancer, okay? Eliminating disparities in healthy food access has been a major state and federal priority in recent years, okay? We've seen some great initiatives like the Healthy Food Financing Initiative that have come to address this particular issue. However, we still see these gaps in food availability. We still see these gaps in supermarket availability across communities based off race, ethnicity. And many of the drivers of these disparities, both in access and in health, is structural racism, and that's what we're going to talk about today. So I like to use Chicago as a case study since a lot of my research is based in Chicago, but taking a closer look at Chicago, this map shows you the food deserts in Chicago. Everything on the left side of the map, and everything highlighted in red, are communities with limited access to a grocery store. And as you can see, all of these communities are majority Black communities, okay? So the issues of food deserts, that grocery gap, particularly in a large urban setting like Chicago that's very diverse, but also very racially segregated, it mostly impacts the Black communities in Chicago. So yes, when we think about disparities in food access and food insecurity, we have to think about structural racism. Okay, so today I'm going to walk you through 3 examples of structural racism and how they impact healthy food access. The first is supermarket redlining. The second is differential quality. And the third is chronic disinvestment. Okay, so we're going to walk through and I'm going to define all three. The first is supermarket redlining. So supermarket redlining occurs when a supermarket, and most often this happens with the national chains, the big chains, when they close a store in a minority community and or relocate that store to a more affluent area. Okay, so that means that they're closing their store permanently, or they pull out of a minority community and they relocate to a more affluent or more suburban area or majority white community. Okay, the issue with that is that the closing of this store is not prompted by economic duress or market competition. Stores and businesses close all the time, but often it's for economic reasons, okay? There's too much market competition, the store is not making enough money, or there's not enough traffic or whatever. But oftentimes, that's a different scenario. That's a different case. Supermarket redlining occurs when there's no clear reason why a supermarket brand or a supermarket is leaving a community other than they're leaving, they're pulling out that community. Okay, so redlining historically has occurred across the country. Okay, redlining in the past, decades ago, before it became illegal and discriminatory, redlining refers to as the denial of services, finances, to communities based off of color. Okay, so in the past, housing, bank loans, even healthcare access. Redlining occurs when we draw districts, geographic areas, and these are mostly communities of color, and we systematically deny them specific services, specific products, other types of financial mechanisms. Okay, and that is what we call redlining, and it's illegal. Okay. The issue is that supermarket redlining is hard to track, it's hard to study, because it's hard to establish whether or not, what's the motivation behind a store leaving. But unfortunately, supermarket redlining can create food deserts and it can lead to chronic disinvestment. Okay. And this is happening now. It's been historically happening and it's happening now. Okay. There are stores that close in Chicago all the time, like this particular store that recently closed in the Austin neighborhood on the west side. No clear reason for it leaving, besides that brand, that store just decided to disinvest from the community. Another example is differential quality. And this is another issue that's been hard to track. And that's one of the challenging parts about structural racism, studying it from a scientific point of view, being that I'm a scientist. It's very hard to understand and track these phenomenon. A lot of the evidence we have about differential quality is all qualitative. So we've heard it from the mouths of community residents that the quality of supermarkets, even the same brand of supermarket, is significantly different between communities of color and predominantly white communities. And quality refers to store size, the cleanliness of stores, the amenities in the store, the number of employees, the freshness of the meat and the dairy and the fresh fruits and vegetables, the marketing practices as well. There's evidence that shows that supermarkets and communities of color are more likely to market unhealthy food items like candy, chips, snacks, as well as sugar sweetened beverages. Okay. And like I said, there's very little quantitative evidence to document this, but there's a lot of qualitative evidence. So this is another example of structural racism that we need more evidence to actually really show people that this is going on. And the next thing is chronic disinvestment. Chronic disinvestment occurs when food retailers, especially chain supermarkets, the national chains, they do not open in a community of color for a long period of time. And I'm not talking about a year or two, I'm talking about decades, okay? So it creates these sort of permanent or chronic food deserts, okay? Oftentimes when I see stories of communities of color getting a grocery store, they hadn't had one in 10 years. 20 years. So you see this long-term disinvestment from the city, from retailers, across the country, just not investing in this community over time. Okay. And when communities receive businesses and retailers, it's good for the community because it creates job opportunities, okay? It also and revitalizes the community. So that deals with issues of blight. And then when people have job opportunities, it also improves social cohesion. It cuts down on crime. So, you know, chronic disinvestment is a major issue. Also, when you're in a community that doesn't have a grocery store for long periods of time, you start to see an overabundance. You know, there's a reason why these communities have an overabundance of smaller retailers, okay? Smaller retailers are your corner stores, your gas stations, your liquor stores, and your dollar stores, okay? Dollar stores like Family Dollar, Dollar General, the 99-cent store, Dollar Tree, okay? The overabundance of small food stores can make a community less attractive to a national grocery chain because they might think that these number of small stores around the grocery store, it will drive away or it'll pull away potential customers. So then, you know, the store might not be successful or viable. So then they'll decide not to invest in that community, okay? And then you see this proliferation of small stores like dollar stores, okay? There are over 30,000 dollar stores in the nation. And many of these stores are located in low-income communities and communities of color, okay? Often, you know, so often that many people accuse these brands of targeting, unfair targeting, okay? Which is another form of structural violence and structural racism, okay? Dollar General right now is opening tons of stores. They've actually been doing quite well throughout the pandemic because as people lost their jobs in 2020, we had an uptick in unemployment. Many people start shopping at these stores, these smaller discount stores. However, these stores often don't carry a lot of fresh fruits and vegetables. So, you know, they're making the grocery stores less profitable. And, you know, it's you know, them being so saturated in communities, it makes stores not want to come in. So yes, this is an issue. So chronic disinvestment is a major problem. So what are communities doing to address structural racism and these issues? Well, they're addressing it through agriculture, okay? So I've seen a number of community organizers, groups, you know, different entities and communities of color that are advocating to get fresh agriculture, local produce into their communities. And they're doing it through a number of different mechanisms. They're doing it through urban farms. If you go to Chicago, there are a number of wonderful urban farms on the south and west sides of Chicago. These farms have educational programs. They have job opportunities. They have programs for youth, recently incarcerated individuals. So they're great. They're great for the community. You see farmers markets and farm stands. You see the urban gardens. They're taking areas of the community that were, you know, that were experiencing blight or, you know, the infrastructure was falling apart, and they're revitalizing it for urban farms, okay, and urban gardens and CSA programs. And then finally, organizations such as Experimental Station, they're operating nutrition incentive programs. So they're bringing incentives for people who are on SNAP. So the Supplemental Nutrition Assistance Program or food stamps, they're bringing these programs into communities for people to use at these various different, these urban farms and these farmers markets. So what can you do? All right, what can you do? If you're really passionate about this issue, one of the things that you can do is support minority-owned businesses. Support the grocers, the supermarkets in communities of color. Support any place that sell food in communities of color, okay? Supporting minority-owned businesses is a great start, okay? Next, patronize the direct to consumer food retailers in communities of color. So in the summertime, I know people love going to the farmers market. You want to get your fresh local produce. Go to the farmers markets in communities of color. You know, I did a research study in Chicago where we looked at farmers markets in communities of colors, particularly Black communities. And, you know, they have to attract vendors and they have to keep vendors. And that means that they need business, they need foot traffic. So go to these particular markets and support them. Support the local organizations and leaders and advocates who are actively working to improve health in communities of color. You know, they often have fundraisers. You can donate, you can volunteer. Support these people and these organizations. The next thing is vote. Vote. I tell people, vote all the time. Vote in your local elections as well as the national elections. Because believe it or not, a lot of these local and national initiatives, these programs for businesses that aim to expand healthy food retail and bringing in resources to deal with nutritional inequities in communities of color, they are written by policymakers. They are championed by politicians. So we need to know our leaders. We need to know their stance on different issues, and we need to vote accordingly. Know what your local leaders are interested in supporting in terms of community nutrition, and know their stance on racism and vote accordingly. And next, the last thing that everybody can do is do your part. Be a part of the conversation of dismantling racism and racial injustice in your own community, in your own space. If you can just focus on your own space, then we will actually make some progress in this country, okay? So your own space is your home, your family, your workplace, you know, any space that you occupy. If you can be a champion of change in that space, that would be great. If you are open to having the conversation and you call out acts of racism and racial injustice, that's a great place to start, okay? So thank you so much for listening to my brief talk about structural racism and nutritional inequities, particularly pertaining to access to healthy food. If you want to connect with me, please feel free to email me. Again, I'm in the Department of Kinesiology and Community Health at the University of Illinois. You can also follow me on Twitter at Dr. C.R. Singleton. Thank you so much, and thank you for the invitation.
Thank you.